Good day, everyone. I am Arvijal Maria, and together with my partner, we are going to discuss about cardiomyopathy. First, what is cardiomyopathy? It is a descriptive term that means disease of the heart muscle. Cardia, from the word cardia, that means heart, and myopathy, that means abnormality of muscle. So, disease of the heart muscle. So, when talking about cardiomyopathy, it focuses on the ventricular heart muscle, the bottom two chamber of the heart. So it primarily affects the myocardium itself and making it harder for the heart to pump blood. And it also reduces blood output and may lead to heart failure.
So, before we proceed to basic anatomy of cardiomyopathy, ang explain ko muna is the blood circulation in the heart. So, blood circulation in the heart is divided into left and right side. So, the right side is the flow of the oxygenated blood, then the left side represent the flow of oxygenated blood. So, may step para matandaan kung paano ba nagse-circulate ng blood ang ating heart. So, first is that the oxygenated blood starts to run from the body. It flows into superior or inferior vena cava. Then, the flow of the oxygenated blood reaches the right atrium. Then, the atrium will push the flow through the tricuspid valve. Then, it will be pushed to the right ventricle, and the line will continue to pass the systemic veins and flow into pulmonary valve. The oxygenated blood is pumped into the lungs through the systemic arteries. The marginal arteries will provide the heart muscle with blood. The hemoglobin comes in the pulmonary veins. It reaches the right atrium. The flow of the blood goes through the bicuspid valve. The valve will pull it into the left ventricle. Then blood line moves to the aortic valve. Then after that, it flows through the aorta and coronary arteries. Then finally, the oxygen-rich blood moves back to capillary muscle and body. So for the basic anatomy, so makikita natin dito is yung normal heart, which is the interventricular septum is normal. So the normal heart muscle carries out the pumping action by squeezing and relaxing in a rhythmic way. So kanina na-explain yung cardiomyopathy is a condition that causes the heart muscle either to stretch, stiffen, or weaken, causing the heart to not to pump properly. As this progress, it can ultimately lead to heart failure. There are types of cardiomyopathy, which is discuss naman mamaya. So, sa dilated cardiomyopathy, makikita natin dito yung dilation or pag-stretch ng muscle fibers niya. So, kapag sinabing dilated cardiomyopathy, it is caused by overstretching of the heart. Due to this, the heart can squeeze blood out properly. So, kapag sinabing hypertrophic cardiomyopathy, makikita natin dito yung pag-excessive wall thickening niya.
Pathophysiology of cardiomyopathy. Cardiomyopathy may be developed from family history of heart diseases, especially cardiomyopathy, heart failure, and sudden cardiac arrest. And also, it may be developed from a long-term high blood pressure or having past heart attack, coronary artery disease, or an infection in the heart or ischemic cardiomyopathy. Another predisposing factors are obesity, long-term alcohol misuse, illicit drug use, diabetes, thyroid disease, and storage of excess iron in the body or hemochromatosis. As a result of this series of predisposing factors, it decreases stroke volume that stimulates the sympathetic nervous system and the renin-angiotensin-aldosterone response, resulting in increased systemic vascular resistance and increased sodium and fluid retention, which places an increased workload on the heart that may cause heart failure. If there's heart failure, These signs and symptoms may be developed: shortness of breath, fatigue, rapid heartbeats, chest pain, swelling of limbs, dizziness, and fainting.
So, there are 5 types of cardiomyopathy. So, the first one is dilated cardiomyopathy, which is the most common type. In this type, the heart's main pumping chamber, which is the left ventricles, become enlarged or dilated. And it can effectively pump blood out of the heart. Although this type can affect people of all ages, it occurs most often in middle-aged people, and it is most likely to affect men. The next is the hypertrophic cardiomyopathy. So, in this type involves abnormal thickening of the heart muscles, which makes harder for the heart to work. It mostly affects the muscle of the heart's main pumping chamber, which is left ventricle. Hypertrophic cardiomyopathy can develop at any age, but the condition tends to be more severe if it occurs during the childhood. So, most people with this type of cardiomyopathy have a family history of disease. Some genetic changes have been linked to hypertrophic cardiomyopathy. And the next type is the restrictive cardiomyopathy. So, in this type, the heart muscle becomes stiff and less flexible, so it can expand and fill with the blood between heartbeats. This least common type of cardiomyopathy can occur at any age, but it is most often affects older people. Restrictive cardiomyopathy can occur for no known reason or idiopathic, or it can be caused by a disease elsewhere in the body that affects the heart. Next is arrhythmogenic right ventricle dysplasia. In this rare type of cardiomyopathy, the muscle in the lower right heart chamber, which is the right ventricle, is replaced by a scar tissue, which can lead to heart rhythm problems. It often caused by genetic changes. It can it it's often caused by genetic changes. And lastly is the unclassified cardiomyopathy. So other types of cardiomyopathy fall into this category. So for the diagnostic test, so these are the tests that can help to diagnose cardiomyopathy. So first one is the echocardiogram. So this is the main test for diagnosing cardiomyopathy. So it will be make a sound waves that can be produce images of the heart in motion. So an echocardiogram shows how blood moves in and out of the heart and heart valves. It can tell if the right ventricle is enlarged. Next is cardiac MIR. This imaging test can show the size and function of the heart's pumping chambers. A cardiac MIR uses magnetic fields and radio waves. The next is the electrocardiogram. Next is electrocardiogram or ECG or EKG. So this quick and easy test records the electrical activity of the heart. An ECG can show how fast and how slow the heart is beating. So patterns in the signals can help to diagnose heart rhythms disease or reduce blood flow. Next is chest X-ray. A chest X-ray shows the shapes and condition of the heart and the lungs. It can reveal fluid in or around the lungs. The next is cardiac catheterization. During this procedure, one or more long thin tubes or catheters are inserted into blood vessels, usually in the groin, and guided to the heart. Then during this test, a sample of tissue or biopsy can be taken to check for the heart muscle damage. Then last is endomyocardial biopsy. also referred to as a heart biopsy. It is a type of cardiac catheterization procedure used to collect a sample of your heart muscle tissue so it can be analyzed more closely in a laboratory.
As you can see, we formulate a nursing care plan about activity intolerance related to imbalance between oxygen supply and demand. So in our subjective data, which is belong to assessment data, is mabilis ako mapagod tsaka mataas ang BP ko as verbalized by the patient. The blood pressure is 160 over 110 and the respiratory rate is 36. Pulse rate is 118, which is high above the normal range of pulse rate. And then the autosat, which is lower than the normal range of oxygen saturation, 80%. And then the patient is fatigued. So, after 8 hours of nursing intervention, the patient will be able to increase his or her activity level to perform desired activities. So, we have interventions here which we focus on monitoring vital signs. This is to have a baseline data. And then next is we assess the factors that affect the patient's desired tolerated activities because cardiomyopathy can affect patient at any age. Consider the activity level of the patients, especially children and younger adults. And then the next intervention made is assist in self-care while promoting independence. This is because providing care to the patient ensures that the patient's needs are met while reducing efforts that compromise cardiac workload. And then the next intervention is monitor for an increasing incidence of activity intolerance because increasing activity intolerance may indicate increasing cardiac decompensation. And then the next is schedule interventions with rest periods in between because it ensures that the patient's needs are met without increasing oxygen demand and cardiac workload. And then the last intervention we made, which is collaborative, is encourage the patient to adhere to a graded cardiac rehabilitation program. Because adhering to a graded cardiac rehabilitation program can help strengthen cardiac function without overexertion. And in our evaluation, we have here goal met because after 8 hours of nursing intervention, the patient is able to increase his or her activity level to perform desired activities.
Next is pharmacologic treatments. Combination of medication may be used to treat cardiomyopathy and prevent any complications. So medications are used to control the heart rhythm, help the heart pump better, lower blood pressure, then prevent blood clots, and lastly, reduce fluid from the body. So drugs are used to treat heart failure and also cardiomyopathy include blood pressure medication. So different types of drugs may be used to lower blood pressure, then improve the blood flow and reduce the strain of the heart. So such medications include beta blockers, angiotensin converting enzyme inhibitors, and seco- angio- angiotensin receptor blockers. The next is sacub- sacubitril valsartan or Entresto. So this drug combines an ARB with another type of medicine to help the heart better pump blood to the rest of the body. It used to treat those with chronic heart failure. Then, next is water pills or diuretics. Then a diuretic removes excess fluid and salt from the body. Too much fluid in body strains the heart and can make it difficult to breathe. Is digoxin. Digoxin or lanozine. Digoxin or lanozine. This drug can strengthen the heart muscle contractions, and it is also tends to slow the heartbeat. Digoxin may be also reduce heart failure symptoms and make it easier to be active. Then evapradine or corlador, then corlador, this drug may be used to manage heart failure caused by dilated cardiomyopathy. Then blood thinners or anticoagulants, anticoagulants, these drugs help prevent blood clots.
Have here our nursing management, which is commonly focused on minimizing oxygen demand by maintaining the patient at bed rest, and then provide liquid diet on an acute base. Administer diuretic as prescribed to reduce preload and afterload, and then monitor serum potassium before and after administration of diuretics. And then another one is obtain BP hourly or more frequently if the patient's condition is unstable. Monitor hourly urine output to evaluate effects of decreased cardiac output or pharmacologic intervention. And then analyze electrocardiogram or ECG rhythm strip at least every 4 hours and note rate. Continuously monitor oxygen status with pulse oximetry. Monitor patient activities and nursing interventions that may adversely affect oxygenation.
For medical management is directed toward identifying and managing possible underlying or precipitating causes, correcting the heart failure with medications, a low sodium diet, and an exercise or rest regimen, and controlling dysrhythmias, with antiarrhythmic medication and possible with an implanted electronic device such as an inflatable cardioverter defibrillator. For surgeries or other procedure, surgery may be needed to implant a device to control heart's rhythm or help the heart pump blood. These are the types of device used to treat cardiomyopathy. So first is the biventricular pacemaker. So this device is for people who have heart failure and irregular heartbeat. So biventricular pacemaker stimulates both of the lower heart chambers, which is the right and the left ventricle, to make the heart beat better. The next is inflatable cardioverter defibrillators or ICD. An ICD doesn't treat cardiomyopathy itself. It monitors the heart rhythm and delivers electrical shocks if an irregular heartbeat is detected. Then lastly is the left ventricular assist device or LVAD. So this mechanical device helps weakened heart pump better. LVAD is usually considered after less invasive approaches are unsuccessful. It can be used as long-term treatment or as short-term treatment while waiting for a heart transplant. So kapag lahat ng medication na ginamit or ginawa or yung other treatment ay hindi na gumana sa may mga cardiomyopathy, Kapag hindi na nag-work yon, last choice ay heart transplant.